Hi, I'm Steve Heffron.
And I'm Jesse Canone.
And we're excited to be with you today to share with you some truly powerful, life-changing information.
While you may have tried some of what we'll be covering in the program, we can guarantee that you've never used the specific step-by-step process that we're about to take you through.
It's that exact process that you will use to create a truly personalized self-treatment program based on your current physical condition. Here are just some of the many conditions that can be addressed by using this system. Whether you've been diagnosed with a specific condition or not, you will still receive great benefit from using this program. Because unlike most treatments, by using this system, you will identify and address the underlying cause of the conditions that are creating your pain. And we will cover these conditions in more detail throughout the program. As powerful as this system is, it simply will not work if you do not do it. So I need to ask you to make a commitment to yourself right here, right now.
We promise that if you go through the program from start to finish and work with it consistently, it will help you to reduce or eliminate your pain.
In order to make this system as easy to use and as easy to understand, we've broken it down into 3 simple steps. Step 1, education. What you will learn in this step holds the key to your success. Step 2, the assessments. This is where you will identify the dysfunction that is really the hidden cause of your pain. Step 3, treatment. This is where you will develop your personalized self-treatment program in order to address both the cause and the symptoms.
It really is that easy. Once you've gone through the program, you'll have created a customized self-treatment program that will take just a few minutes each day, but it will deliver far better results than anything you've likely experienced before.
In this section of the program, you're going to learn about an incredibly simple yet powerful concept. So pay close attention and take notes as necessary. Here's Steve and Jesse again to share with you the real secret to getting relief.
Easy, just like that. Hold it there.
Back pain does not happen overnight.
Should feel all that.
While the pain may appear suddenly, the condition has been developing for years. In order for you to understand this, it's important that you understand how your body works. The human body consists of over 600 muscles, and normally they are balanced and work together. This allows you to move and function without creating injury or pain.
Because most people live very sedentary lifestyles and spend so much time sitting, over time they develop muscle imbalances. Some muscles get overworked and become tight, while other muscles get underused and become weak. And while this inactivity can create muscle imbalances, exercise can make things even worse.
Exercising without knowing which muscle imbalances you have means you could be strengthening or stretching the wrong muscles, which in turn will make your condition worse.
It's these imbalances that put your bones, joints, and spine out of place and into what we call physical dysfunctions. Here's an example of what muscle imbalances can do to your back. As you can see, there's excessive curvature in the lower spine, and functioning like this will ensure both muscular and disc problems. While you can go about your life with these dysfunctions, it's only a matter of time before the uneven stress and excessive wear and tear results in a condition like a bulging or herniated disc, sciatica, and the list goes on.
It's important that you understand the process of how back pain develops and how to treat it. We know that back pain isn't caused by your condition. Back pain is actually caused by the muscle imbalances that over time develop into physical dysfunctions. Those physical dysfunctions over time create your condition, and it's that condition that creates your pain. The problem with traditional treatments is that they bypass the first 2 steps in the process. Instead of identifying the imbalances and dysfunctions, they treat just the symptoms with things like cortisone injections, anti-inflammatories, and generic therapy. This usually results in temporary relief, if at all. As pain persists, the next step is often surgery. And for many, surgery fails to give relief because it does not deal with the underlying problem.
Here's why our approach works so well. Instead of beginning by treating the symptoms, with our program, you're going to first identify the imbalances that you have. Then, with corrective exercises and stretches, you're going to improve and correct the dysfunction. And by doing that, that will in turn eliminate or improve the condition, and then the pain goes away. So now you can see that your back pain was not caused by a condition you may have been diagnosed with, but is instead a direct result of years of living with these dysfunctions. And the only way you're going to get rid of this problem is by identifying the dysfunctions that you have and addressing the muscle imbalances that have created them. And that's exactly what you're going to do next.
So let's move on now to the self-assessment portion of this program.
In this portion of the program, In this portion of the program, you're going to learn about the 4 most common physical dysfunctions, what causes them, and how they are in fact responsible for your condition and pain. Then, we're going to take you through a series of simple self-assessments so you can identify which of the dysfunctions you have.
The best way to identify a physical dysfunction is through what we call a visual assessment.
The first dysfunction we're going to cover is what we call the forward-tipped pelvis. Here's an example of what this dysfunction looks like. The forward-tipped pelvis is caused by a tightening in the muscles of the hip flexors and a lack of strength in the muscles of the glutes and lower abdomen. The combination of these imbalances creates an excess of curvature in the lower spine, which can lead to both muscular and disc problems. The first thing to look for is a downward sloping of the belt or waistline. You're also looking for any excessive curvature in the lower back. The next thing to look for is a forward lean of the body from the ankles up. Here's how to find out if you have this particular dysfunction. The next assessment we're going to perform is the hip flexor flexibility test. Begin by kneeling on one knee. Once you're in this position, you're going to tip the pelvis backward by contracting the glutes, tightening the abdomen. Once you're in this position, you should feel tightness and restriction here in the hip flexor or the top of the thigh. If you're unable to achieve this position, you have very tight hip flexors, and this contributes to a forward-tipped pelvis. If you are able to achieve this position, we'd like you to move the hips forward to see how far you can get. If you're unable to achieve this position, you have tight hip flexors, and again, this contributes to the forward-tipped pelvis. Be sure to perform the assessments on both sides. Next assessment, lower back flexibility. Begin by lying on the floor. You're going to slowly lift your knees towards your chest, grab the top of your knees with your hands, and pull your knees towards your chest. If you're unable to achieve this position because of tightness, pain, or restriction in the lower back muscles, it's likely that you have a forward-tipped pelvis. Next assessment, quadricep flexibility. Begin standing, holding onto a chair, wall, or countertop for balance. You're going to bring your leg up behind your body, grab the foot with your hand, pulling the foot all the way in towards your buttocks. Once in this position, you're going to tip the pelvis backward by contracting the glutes and abdomen. What you're looking to do here is maintain the foot up against the body and the knee pointed directly straight down towards the floor or slightly backwards. If you're unable to achieve this position, it means the quadriceps are tight, and tight quads contribute to the forward-tipped pelvis. Okay, next assessment, lower ab strength. Begin by lying on the floor, flat on your back, hands placed by your side, knees bent with feet on the floor. By contracting the abdomen, you're going to pull the knees up slowly towards your chest, as far as you can, and hold, and then slowly lower them back down to the floor using the abdomen again. If you're unable to perform this movement without pain or arching in the lower back area, it means the lower abdomen is weak, and this is a major contributor to a forward-tipped pelvis. Okay, the next assessment, testing glute strength. Begin lying flat on your back, feet on the floor with your knees bent. You're going to place your hands by your side for support. You're going to slowly lift your hips up off the floor into what we call the bridge position. You're looking for a straight line from the knee to the shoulder. If you're unable to achieve this position, it means the glutes are weak. And again, weak glutes are a major contributor to a forward-tipped pelvis. If you can achieve this position, the next thing you're going to do is slowly extend one leg straight out while trying to maintain that straight line from ankle all the way down to shoulder. What you're looking for here is a drop in one side of the pelvis or the other. If the pelvis drops, the glutes are weak. And again, weak glutes contribute to a forward-tipped pelvis. The next dysfunction we're going to cover is what we call a high hip. Here's an example of what a high hip looks like. The primary cause of a high hip is an imbalance in which the muscles of the inner thigh overpower the muscles of the outer hip.